Hi, I'm Dr. Nina Crowley. I'm SECA's Professional Affiliations and Education Manager, and I just got back from the Obesity Medicine Association Spring Conference. I'm excited to share some of what I've learned and some take-home messages that you can take back to your practice. This was a meeting of obesity medicine physicians, advanced practice providers, and then integrated health folks like dietitians, and it was a fabulous conference to be able to kind of be on both sides as a participant, learning about the up and coming, things that are going on within the society, some of the new research, especially on the anti-obesity medications, but also to represent SECA and be able to talk with folks who come back from their sessions and want to talk about what they're learning. So I was able to make a lot of connections about what we're learning in session and then actually how our device provides a solution for some of the struggles that folks have. One of the most interesting talks I went to at OMA this year was a talk by a doctor who was dual boarded in obesity medicine and internal medicine, who was talking about the differences in her Black patients who at any given weight have a higher body fat percentage, and in particular the Black women who have a higher subcutaneous fat, which is not as related to the visceral adipose tissue that's surrounding our organs, related to the cardiometabolic outcomes. Her talk was really focusing in on how using weight and BMI in this population in particular was not as effective and may even overestimate obesity levels when the patients are actually metabolically healthy. Another take-home message from this talk was referencing Dr. Cody Stanford's research looking at BMI cutoffs in Black women in particular. So she's suggesting a higher cutoff, somewhere like BMI 31 and 32, because at that certain weight, her patients in this research study were not having the same levels of cardiometabolic issues that they had at the other BMI. So I think this is all kind of taken together, looking at how are we measuring adiposity, and are the current measures of weight and BMI really appropriate for all the populations. So I was excited to see some new discussion happening about how we're going to maybe make some changes to these cutoffs that relate to different ethnic groups, different health conditions. So people who have these outcomes may be stratified differently according to their weight and BMI. Stay tuned to more insights on all of our social media so that you can hear what's happening at all of the conferences I'm able to attend.